So in this lecture we are going to look at how healthcare has really evolved over time and why has it happened. So modern healthcare, to be developed and supported and grow, it needs a couple conditions to be met. First, it must be effective medical technology, the low risk of death, that improving health must be worth it, the ability for patients to pay for advanced care, and the financial organizations to facilitate those transactions. All right, so all these are necessary in order for modern healthcare to really grow. The first thing to note here is the idea of the natural rate of population increase. If you're looking on a global scale, it's the only way the population can increase. And it's the birth rate, number of people who are born, minus the death rate, number of people who die. So when we look at different periods, first one we look at is the Stone Age. Stone Age goes from about 5 million to 10,000 BC. So basically pre-10,000 BC. The economy was the hunter-gatherer, and the total population went from beginning to 4 million. Now, the distribution of income during this time was roughly equal because you didn't really have any kind of economic system in place at the time. Now, the growth rate. Now, this is going to be an important rate to note here. The growth rate the growth rate was about 0.0007%, which meant the population doubled once every 100,000 years. Medical care during this time was shaman witch doctor. Life expectancy was only 28 years. And again, the economy really wasn't formed at that point, so medical was not applicable. The agricultural age went from 10,000 BC to right around the block, 1800 AD. The economy was farming and harvesting. The population went from 4 million to 100 million. Now, the distribution of income during this period was very, very top-heavy and unequal. And the biggest reason for that was slavery during that time, where you had a large group that were not getting paid anything. And that allowed certain individuals to control larger portions of the money. Now, the growth rate was 0.046, so the population doubled once every 1,500 years. Now, keep in mind that is in contrast to the Stone Age, when the population doubled every 100,000 years. Medical care was empirical. It was trial and error. Now, life expectancy did actually go down during this period. And this is a period where there was a lot of wars, there was a lot of sickness, epidemics, and so a lot of people died in childbirth, or in the younger years, and not many people lived as long because of the wars going on. Now, the modern economy kind of started, but it was very, very small. So during this time period, staying with it, there was a lot more investment in trading during that. The class system evolved. There were different types of jobs, and that caused a lot of war and government to be needed. Now, some civilizations did decline, and because of these wars and because of these diseases, plagues, and so it caused a lot of civilizations to go down or fall off completely. The Black Death, for example, knocked out about 25% of the European population. And other plagues knocked down or out other civilizations. The Aztecs, for example, fell from about 17 million to 2 million in the 1500s. From 1500 to 1750, the population rapidly grew, but the problem was that the food supply, based on the technology at the time, was pretty limited. So scarcity of food became an issue. This was also the time of the modern economy growing. And the Malthusian hypothesis basically said that food supply is a constraint to population growth. And so more people is going to lead to less productivity because of crowding, because there's only so much to go around. So that's the agricultural age. The industrial age went from 1800 to 1950. That's when the economy was heavily manufacturing driven. Total population went from 400 million to 1.6 billion. Income was a little bit mixed. Now the growth rate continued to speed up. It's up to 0.65 now. So the population went from doubling once every 100,000 years to 1,500 years to now 108 years. Medical care is still empirical, but the life expectancy went up. Now you see a wide range there, and the reason why is that this period, the latter portion of it, as medicine became better and as technology and lifestyles were able to become better, people were able to live longer, especially towards the latter portions. Medical started to grow. Right? Now it's between 2 and 4%. Right? So the Malthus hypothesis, there are a couple problems. And the one problem is that it ignored technological advances, and so productivity could rise, and the food supply issue could be resolved that way. Now, during this period, there was less agriculture, and so one of the factors that led to a lower life expectancy during the previous period was children dying early, and that was not as much of an issue during this period. So birth rates tended to go higher during this period, and early death rates were also lower. Now this is when you saw the beginning of the population boom. And when we look at the distribution of income during this period, or during the different periods, and we'll talk about all of them later, the hunter-gatherer mostly was lower class because there wasn't much of an economy. Agricultural, we talked about, was very top-heavy. Now the industrial, that's when you had a lot of the rises in the unions, and so the middle class became much better off. And we'll talk about the information next, which was a little more even. So the information age, which is the age that we are currently in, is since 1950 and looking forward. We have shifted during this time from a manufacturing economy to a services, and the population has boomed. It's went from 1.6 billion, it's currently over 7 billion. We're not entirely sure of the distribution of income right now because it's constantly changing, but it's closer than it once was. People, however, have been healthier. Now, part of it had to do with better medicine, vaccines, but the other part is that lifestyles are better. By not having the typical manufacturing jobs where we had services, they are much less labor intensive, so people were able to live healthier lives from that, not put much stress on their bodies. Life expectancy is now over 70 years. Now, medical spending, as we've talked about in this course, has really gone up during this period. Now, as we talk about income and health, in the 19th century, health declined despite higher wealth, but more recently, there's been a pretty strong link between health and income levels. And if we look the mortality rates by social class, this is by job profession. So in general, the professionals, managerial, they're going to be making more money and thus can live healthier lifestyles than the unskilled. Now, if you look at mortality ratios, 1931, okay, 90 versus 111. When you jump to 1981, however, 66 versus 166. And this has been happening in large part because of the transfer of wealth between classes, as the higher incomes have been gaining more money, whereas the lower incomes have been getting a smaller piece of the pie. Now, as the economy developed, people had more, and because they've gained more, they've had better lifestyles, they've had more things to do, they've had, as they've been able to become more productive, they've had more time available, less stress on their bodies. So as that has happened, as people have gained more, the risk of losing everything needs to be reduced. So the idea is that the more you have to lose. And so people took risks to kind of cut back on that. The value of risk reduction in your life is going to depend on your income. People who are earning more are willing to pay more for goods, good care, to reduce risk. So, this just takes a look at the value of life. So basically, these are values that people put on themselves. The sources here, but the basic idea is that as we've gained more over time, as society has evolved, people want to take better care of themselves because there's more things to enjoy, more things to let you have a long, healthy, and better life. More recently, the rise of modern medicines. What we talked about is necessary for change and growth of a system over time. As science and technology has gotten better, medical advances have grown at an exponential rate, especially in recent years. But the big question is, did medical care increase life expectancy? While it is the case that higher income leads to higher life expectancies, the same can't be said for higher medical care, at least a higher life expectancy. So one of the things we noted earlier in the course is that the number one determinant of good health is lifestyle. And so what has been shown is that it's really lifestyle that determines how healthy you are, and not necessarily medical care. And so now medical care still plays a part in it, but the statistics have shown that it's Medicare is more supportive, but if you lead a healthy lifestyle, you're going to tend to be healthy overall. And so it's the biggest question is medical care worth it? And when it comes down to a life or death situation, yes. But when you look at it in the schemes of medicine being the kind of supportive, whereas lifestyle being the number one, then the idea becomes a little more murky. So it's not black and white, basically.